Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. Public health decisions rely on up-to-date CDC data, but in 2025, some key federal health databases suddenly stopped updating without explanation. Today, Boston University's Janet Freilich joins Stephanie Desmon to discuss her team's new research, explaining what information is missing and why trust in government data is really vital to the nation's health. Let's listen.
Janet Freilich, thanks so much for joining me.
Thank you for having me.
Today, I want to talk about public health decisions. I know that the CDC collects a lot of real-time data about what's going on health-wise in the country. They use this information to make vaccine recommendations, to work on outbreak response. Your work has shown that in 2025, some of that data started disappearing or not appearing. And I'm wondering if you can talk us through what happened. Maybe start with what kinds of health data does CDC normally track and why does it matter?
The CDC tracks a wide range of data on a wide range of topics. We were focused on data sets that were intended to be frequently updated. So this is information that might change quickly over time. This is things like infectious disease burdens, pathogen tracking, vaccination rates, and a number of other topics. And what we noticed is that there were a number of data sets that had words like weekly in the title, that when we looked at them, didn't have any information for the past week, or the week before that, or the week before that, or the week before that. And we wanted to get a more systemic sense of what was going on. And we ended up finding some really long delays, really long gaps in updating for a lot of data sets at the CDC.
What is it about this real-time data that is collected? Does it help us spot outbreaks? Does it help us to prepare for disasters?
Real-time data helps us understand what's going on with situations that change quickly. So it could help us spot outbreaks. For other types of data collection, things like vaccination, it can help us prepare for outbreaks. It can also help target outreach. So if you're working in the public health space, you might want to know how many people in a particular region have gotten vaccinated. So you know, is this somewhere where I need to do more work to target vaccination campaigns, or should I put my resources somewhere else? So it helps those kinds of fast-moving decisions, fast-moving responses.
And you found that a lot of data sets that purported to be updated regularly were not being updated, yes?
That's right. We found that almost half of the data sets, we looked at data sets that were supposed to be updated at least monthly, so monthly, weekly, or even more frequently. And when we looked, which was towards the end of October of 2025, we found that almost half of those data sets had not been updated, some for a very long time, some for more than 6 months.
What, in real terms, does this mean? Why does it matter?
Most of the data sets that were not updated were about vaccination tracking. So there were still some data sets that were being updated, but the ones that weren't were almost all about vaccination tracking. It's a mystery around vaccination rates and how they were changing in 2025. And there are two problems. First of all, if you are a clinician and you're trying to make a recommendation about vaccination to your patient, you don't have a good sense of what the world looks like. And then the second problem, which I've already spoken about, is if you are trying to target a vaccination campaign, you're not necessarily going to know what the best strategy is around that. It's a particular challenge right now because there are an increasing number of organizations that are issuing vaccine recommendations that are different from what the federal government, from what the CDC is issuing. And it is difficult to do that without information. And a lot of the information that underlies these decisions actually comes from the federal government.
Can you elaborate on that a little?
The federal government collects huge amounts of data. This is not just CDC, but this is across agencies, across topics. The government repository, it's called data.gov, has hundreds of thousands of data sets last time I checked. There's been a big push for the past 15 or so years to increase the amount of information that gets publicly posted from federal agencies. And the rationale there is transparency, and also because the federal government is just really good at collecting large-scale data because it's big and because it has comprehensive access. And so the CDC has been posting many data sets that really gives us a foundation for what's going on with public health in the country. Some of these do come from other sources. Sometimes the CDC collates data collected by the states, but the CDC, the federal government, is the number one source for federal level data.
I see this and a short-term impact. Are you concerned about long-term impact?
Some of the data sets are being updated again now, although not all. And so some of that impact does get mitigated. I think the long-term impact has more to do with the underlying structure of how public health practitioners can rely on federal data. It used to be that the federal government data was seen as generally reliable and trustworthy. It wasn't perfect. I've written about some of the criticisms of it over past years, but by and large, the federal government was going to be the best source of information, and it was pretty reliable. The CDC, if it said it was publishing something weekly, for the most part, it published something weekly. That's changed. So it creates instability there. We don't know whether data is going to be there next week or not. And so it's hard to know what to rely on. And I do think there's been across the board diminished trust in data available from the federal government, sort of coupled with diminished trust for public health authorities more broadly, which creates real challenges for public health.
I'm curious what you found in your paper. Why do we think this is happening?
We don't know. We didn't figure out an exact reason, and we don't say that in the paper. There are a number of possible explanations. A lot of these pauses, as we call them in the paper, in data updates happened around March and April of 2025. If you'll recall, the CDC underwent a major reorganization around that time, and many, many, many staff members were laid off. It's very possible that the personnel just weren't there to do this. It's also very possible that it wasn't a priority, given fewer personnel. So vaccination data collection may have been less of a priority. And it's also certainly possible that it may have been a political decision as well.
Should we see this as a temporary technical issue or a broader policy and infrastructure problem?
I think this is a broader policy and infrastructure problem. It is not only at the CDC, and it's not only with paused data sets. There have also been instances where some information has been removed from government websites or altered on government websites. And so it's a more systemic issue. One of the challenges around data, and I'm a lawyer, not a doctor, so I think about the legal challenge side of this. One of the challenges is that many of these data sets are not mandated by a statute. So they're not mandated by a law that has been passed by Congress. They exist because somebody at the agency decided to create these data sets, which is a good thing in some sense because it means that the agency has some flexibility and can be nimble and can respond to different situations. But it also makes many of these data sets very vulnerable. If agency leadership wants to stop collecting information, there's not a lot stopping that from happening. And that may be what we're seeing here.
It's kind of a situation also, I imagine, of we don't know what we don't know, right? I mean, if suddenly all these databases disappear or stop updating, we may not even realize what's lost.
That's right. It's fairly difficult. I've done a lot of poking around on the CDC website and on other agency websites, and it's tricky to figure out what used to be there and what's there now. There are some interesting efforts to preserve government data. The Harvard Law Library has one of those. There are a number of other organizations that are trying to do this. It's a huge amount of information, and it's not necessarily organized in ways that are intuitive or easy to index, which is partly why that's a difficult thing to do. But certainly there are people trying.
If these pauses continue, what risks could that create for public health, for medical decision-making?
You can't make a decision blind. It's so important to have accurate, up-to-date information about what is happening on the ground in order to inform a decision. Otherwise, it's guesswork. You may or may not be right about what's actually happening. And the CDC has been so good about providing information. And so it's a shame if that's changing.
So what's the solution?
What's the solution? I have been thinking a lot about this, and I'm sorry to say I don't have a perfect solution right now. I think that if Congress were motivated to pass statutes, to pass laws that mandated collection of some areas of information, that would be good. I don't see that happening right now, but in general, if information were made more sticky, if it were harder to change, that would address this particular problem. I think another category of recommendations is on the transparency side. It's a shame to lose information, but there are lots of good reasons why an agency might need to change the information that it collects, need to change its collection methods, might need to delay collection information, might need to change the contents of data sets. Those are all legitimate, reasonable activities, but it's very hard to continue to trust information if we don't know what's happening. And so the more transparent the agency can be about information changes, the better. Some of this can be done by third parties that try to track this, but nobody's going to be as good at it as the federal government will be. Also, I'm particularly hopeful on the transparency side because I think some of it can be automated. There's no reason you couldn't have software that is tracking changes across these databases or that automatically produces. Many of these databases have a change log that could be automatically updated as changes were made or lags could be automatically reported. So that strikes me as the more plausible, partial solution here.
This trust issue is so important because I think when data is missing, people start to wonder if there's a nefarious reason for it or if the data is correct. And I work with this in my day job, how to keep trust in institutions. And I'm wondering, is it too late? Is there a way to say, no, this data is good?
I think transparency would help with that. I also think involvement of other organizations can help as well. So, for instance, much of the information that is produced by the CDC is originally collected by states. It sends state governments, it gets sent to the CDC, and the CDC collects and publishes it. It is possible that state governments could get more involved with producing information. It's not a replacement, but it could increase trust. I also worry a lot about diminishing trust in institutions, particularly public health institutions, and I think it's really important to bolster that trust if at all possible, and for institutions to earn that trust.
What's the one takeaway you want our listeners to really understand about this issue?
I think we underestimate how much federal government data affects our lives every day. And this is not just in the public health context, but federal government data underlies so many of the technologies that we use across the board. It's really the backbone of a lot of different applications because there is so much of it and because it's traditionally been reliable and it's free. It's relatively easy to access, all why it ends up being incorporated to different systems. We're a very data-reliant society right now. And so when I first started studying this issue, I was worried that people would think, well, databases, that's boring. It's just a spreadsheet. It's just pieces of information. So I want to emphasize that the decisions we make rely on the inputs, and a lot of the inputs come ultimately from the federal government. And so it's so important that the quality and consistency be maintained there.
One thing you did say that struck me as well was that Congress could mandate the collection of this data, and they do not, and they're unlikely to do so. Is that the only way we protect these institutions when we, change parties every few years in government?
Making data harder for an incoming change of administration to alter, certainly that would improve consistency. Of course, agencies could also put more automated systems into place. Agencies certainly have a lot of decision-making power over the data they collect. It's tricky, though, because when this is happening just at the agency level, agency leadership also has a lot of control over what the data environment looks like. And so when that changes, the agency's choices about data can change as well. That isn't necessarily a bad thing, but it also doesn't always contribute to continuity, as we're seeing here.
Janet Freilich, thank you so much for joining me.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.